support. If there's a fellow person, who collapses, who needs some emergency help, and if there are a few things which can make the difference between the death and the life, are these skills, and that is why it is very important. So gone are the days when the physicians were carrying such crude box containing all these equipments, like the syringe, the otoscope, and the other different instruments which you can see. So these instruments cannot be there present everywhere. So that is why we need to learn some of those skills as well. So I've given you a link. Go through this link, and when you will be going through this link in the video, you will be able to see a young kid which is drowning in the water. So there are some brave people who go and rescue them up, the kid. However, the problem, what happens is what to do after that. So that is where, as I said it, with these basic skills, you can make the difference between the life and death for a person. So that's why these skills are very important. So things like this and all has been going on since a long time. So these are some of those earlier pictures which was there in the 18th century. And with passage of time as well, things has been changing. So similarly, even for this as well. So what has been happening is the first aid is one of the important things, I think, everywhere in the world. People have to take Hippocrates oath. Hippocrates oath is, simple thing is, in simple terms, if you can't help someone, at least don't do any harm. Don't do any harm if you can't help someone. So that is the thing is, we should be able to know when to give it, to whom to give it, okay? And that is the reason why a lot of times what happens is, yes, there are a lot of injuries in which it may not be even used, in fact. So that is why actually the first aid is the immediate care which is given to an injured or suddenly ill person. And that's why I was telling you. So I really believe that every common man as well should be able to know, in fact. Okay, and this is the reason before the basic life support or the advanced cardiac life support. First is aid is the minimum thing, in fact. So there are two things which is really important from the legal aspect. One is the expressed consent, so which is the if there is a conscious, mentally competent person of legal age, yes, that person can give. Something is called as implied consent. Implied consent is if there is someone who is an unresponsive, state and having a life-threatening problem. So that means implied consent. So we also have to be thinking, what are the other legal, medical legal considerations? So what happens is the person who is there in the neighborhood as well, they are the ones who can do it. And yes, if someone is, for example, there is a traffic accident and someone is literally going away from there, indeed, this will be something like nothing less than a crime. And yes, when we are traveling to any of the countries as well, we should keep it in mind. A foreigner should obligate to abide by the laws of the country, whichever one is in, actually. So now coming to the basic life support. So it does happen nearly up to 0.7 million cardiac arrests tend to happen in Europe. Okay, so it's a very huge number. And that is the reason why a lot of times what happens is if someone is doing the early resuscitation and prompt defibrillation, just within 1 to 2 minutes, you can have more than 60% of survival. So this is a chain of survival. So what is this chain? In which you try to early recognize and call for the help. You try to start the early CPR, trying to buy more time. And then do the early defibrillation. And finally, try to initiate the post-resuscitation care to restore the quality of life. So you all would have already heard CPR pretty oftenly. So CPR stands for Cardiopulmonary Resuscitation, which is an emergency first aid procedure used to maintain respiration and blood circulation in a person whose breathing and heartbeats have suddenly stopped. Okay, so as we all are aware, there are three basic vital functions: breathing, circulation, and the consciousness. So, in early days as well, since way back in 1970s, Peter Suffer was from Pittsburgh, is the one who wrote the Cardiopulmonary Resuscitation. Finally, the guidelines came. They were further modified as well. Various algorithms could get into the place for this. There are these documents available from the European Resuscitation Council, and I would really like you all to go through this. And you can get a lot of those official links, the documents, the guidelines as well. So that's what I'll try to summarize. So the main logic of CPR is based on what is called as thoracic pump theory. So whenever we compress the chest, the blood is going to come out of the thorax because by increasing the intrathoracic pressure, okay, and the time of chest compression and of course the decompression should be equal, okay, and that's the reason it should not be like you're doing 30 compressions and 45 decompressions. No, that doesn't suit well. So this is the reason. So something is called coiling and recoiling. So the decompression is a more of a inactive process. So it should completely be released, in fact, and hand should never be off the chest. So what happens? We all are aware the oxygen content of the atmospheric oxygen air which we breathe in is nearly 21%. However, in the alveoli it goes down to 14%. Similarly, once we exhale that, from the diluted air, so it may be around 16 to 18% oxygen. So that is the reason you're trying to ensure that the victim's hemoglobin is going to be over 80% saturated. Yeah. And so what happens during the cardiac arrest? There are few things which we all should be keeping in our mind. First is the asystole, the ventricular fibrillation. In fact, so a lot of these cardiac arrest victims, they have a abrupt cessation of the function, okay? And a lot of these patients also have the pulseless ventricular tachycardia. So the heart is going to be contracting at a very high heart rate without any significant output. So how to differentiate between the VT and VF? Of course, with the ECG or monitor, you can do it. So what you're trying to do is, with the chest compressions, you're trying to give at least nearly 30% of the normal perfusion, which is going to the heart and the brain. And in the meantime, you're trying to buy some time, okay? And always remember that. So within 3 to 5 minutes or beyond that, whatever the damage is happening, there will be irreversible cerebral damage. So that is why you're trying to buy more time. So, and also reverse if there is any irreversible causes for the arrest, in fact. And that is why what happens is, as soon as there is resuscitation of spontaneous circulation, okay, if you are able to do it, however, with passage of every minute, the chances decreases by 10%. So after 10 to 20 minutes, chances are going to be very, very minimum that one may be able to resuscitate. But don't forget, there are cases in which even after 1.5 hours of resuscitation as well, they have been able to revive. So there's no limit for that, but we all are humans. There are some newer tools and machines as well, which has been brought for doing CPR. However, we should know what are the limitations as well for that. So there are slightly different etiologies for the adult, for the cardiac arrest, which is normally ischemic heart disease. However, for the children, most commonly it is suffocation or choking, in fact. VF may happen, but very rarely, and a lot of times trauma, in fact. So, depending upon the etiology, we may have to deal in a different way. So, adults, yes, defibrillator should be, electric defibrillator should be applied as soon as possible. Try to alert and call for help and start with the CPR immediately. However, for the children, okay, start the CPR immediately and then call for help, in fact. So the helplines can be different in your different country, and trying to indications. So what are the different indications? It could be myocardial infarction, malignant arrhythmias, pulmonary embolism, intoxication, electrocution, drowning. The one video which I shared the link, go back to that video. You can follow the channel as well, the YouTube channel. It's a beautiful channel, contains a lot of cardiology lectures as well, and must watch that video. You know how you can make the difference in the quality of life of people, in fact. Then similarly, stroke or other problems as well. So what I was telling is, a lot of times CPR is not even indicated. When? When is it not indicated? For example, if you're aware that the biological death has already started, and we are aware that it has already been like 15-20 minutes before the rescuer has arrived. Similarly, if someone is having a malignancy, there's terminal stage of incurable disease, it might not be so helpful. Similarly, if someone has had a catastrophic head injury, so it decreases the chance for survival. Similarly, if if someone has already expressed a consent, that DNR, do not attempt resuscitation, so then it should not be done. And of course, if someone has been executed, and one of the key things which I really wanted to emphasize was age is not a contraindication for not initiating CPR. So we are aware if someone is having a VF, okay, so that is always a better, it has a better outcome compared to a person with asystole. And so whenever this thing happens, that the timing of defibrillation matters quite a lot. So for example, if within 1 minute you are able to defibrillate, the person has a survival rate of nearly 90%. Similarly, within 5 minutes, survival rate decreases, but up to 50%. Then by 7 minutes, up to 30%. So longer is the time for defibrillation, the chances of survival tends to keep coming down. So what happens is, why I was trying to tell as well, CPR should be started as soon as possible, because within the 4 minutes, the brain damage is unlikely. However, within 4 to 6 minutes, brain damage is possible. And 6 to 10 minutes, the brain damage, high chances are there for that. So as we are aware that especially what happens is, especially the cells of the brain cortex are the ones which are very sensitive for the perfusion and oxygenation. And that is why the irreversible damage is going to start to happen within 3 to 5 minutes, in fact. And this is the reason we all should be really careful how to assess a patient, especially for the signs of cardiac arrest. So if someone is unconscious, so within several seconds, of course. Similarly, if someone is having a respiratory arrest, okay, or someone is having the last gasp, or it is called as gaspal breathing. So it is nearly like 1 to 3 minutes of cardiac arrest. However, if sometimes we may be able to see also the pulseless or arteries. So especially when we try to palpate for the carotid or the femoral arteries, we can feel that. Otherwise, when we try to look on someone's color or the face changes, it's completely pale. Others, so yes, that is the other one. However, if we see pupil dilatation, what is called as mydriasis, it is not a reliable sign for this. So the old guidelines, what used to say was the signs of cardiac arrest are unconsciousness, no reactivity, and also loss of normal breathing. However, things have changed. So what happens is, whenever we are trying to think for the CPR, the rescuer's safety is the first priority. Okay, so they should be able to take care for their own safety as well, and to assess the risk of trauma intoxication, and also the infection. Try to see for the victim's position. Is it supine to her or on her back, in fact? And always try to use a flat surface. It should not be, foamy bed, which is going to make the compressions less effective, in fact. Similarly, the victim's position for in relationship to the rescuer's position. So the rescuer should be in a comfortable position to be able to do the CPR. And then a lot of times question comes is like, how about CPR during the transfer? That's why I said it. Now there are devices, mechanical devices, which can do that. Okay, and the rescuer can take some rest as well. And yes, one of the key things we all should try to take sure that the rescuer doesn't place himself at a more risky position. So that is why before starting the resuscitation, try to have a look around. Look for ongoing traffic, electrocution, toxic fumes, or poisons as well. It should not be happening that, okay, you see someone in a busy road, someone has fallen down and you start doing CPR over there. No, that's not wise. Try to take that person immediately to a side, a little bit safer position. Otherwise, you yourself will be having the risk of to be run over by the vehicle. Okay, so that is also important, in fact. And then always try to also see for what is called as universal precautions. Universal precautions, try to think for the airborne infections and also the bloodborne infections. So bloodborne infections like hepatitis B, C, or even HIV can be easily transmitted through the blood, solutions, excreta, sweat as well. Sweat chances are very less, like up to 1% as well, but it may happen. Similarly, the airborne infections. So whenever you're trying to think about the tuberculosis bacilli or the herpes or the meningococcal as well, so it can get easily transmitted through the mouth-to-mouth breathing as well. So self-protection is important. So what can you do for that is use personal protective equipments in the form of gloves, barrier protective devices, or the mouth to barrier devices as well. I'm going to show you some examples for that. So because as I was telling you, these are important to take care of oneself, especially from the infection. And as I was telling you, and it is better to use these protection devices. Okay, so this is why the concept of universal precautions has been used, in fact. So barrier devices are quite a lot available, like face shields, pocket face masks, handkerchief as well. Similarly, towel as well is pretty something easily available, which can be sensibly used, in fact. Okay. And okay, once you have initiated the CPR, so when should you stop? So if the victim is already starting to breathe normally, medical assistance has come, okay, and they ask you to stop, then yes, if you're physically exhausted as well, you should. Similarly, if CPR has been done for more than 20 minutes and still there is no restoration of the spontaneous circulation, it should be stopped. However, before that, if you are really feeling physically exhausted, you think you may not be able to help. Otherwise, if there are signs of biological death, like the post-mortal rigidity, the post-mortal cooling, even the gravity-dependent livid states are there as well, you should stop it. So there are different letters which is there for the adult and the cardiac one. So for the basic life support, it goes like ECA. So EKG, circulation, airway, breathing. However, ALS, the advanced life support, is the one which includes the drugs as well. So the main difference between the basic and the advanced is the use of drugs. So the adult basic life support consists of, if you find across a person, shout for help, open the airway, you try to assess the breathing, you try to call the emergency service, whichever is there present in your country. Start doing the compressions. After that, the 2 rescue breaths and the 30 compressions. So this is how you do it, in fact. So I'll try to show you some of the pictures to make it easier for you. So always go to kneel by the side of the patient, victim, and ask, are you all right? Are you okay, sir? Are you okay, ma'am? And yes, if they are able to respond well and good, then ask them. You can always ask what was wrong and all, reassess them regularly. But if someone is unresponsive, immediately shout for help. Okay, still someone is unresponsive, then that is the time you will try to open the airway. Okay, after opening the airway, you try to go close to the person's nostrils or the mouth. You're trying to check for the breathing, in fact. And when you're trying to hear, then on the same time, you will also, for example, this lady is looking on the chest as well. You're trying to see for the breathing. So you're trying to feel as well. You're trying to visualize as well the chest compressions over here. After that, look, listen, feel. So you have already tried for the normal breathing. Even after that, you notice there's apnea. Otherwise, if there are gasps, or which is called as the agonal breathing. Okay, so agonal breathing is like the barely heavy, noisy, or gasping breathing. So this is an important precursor for the cardiac arrest, in fact. Okay, so in the basic life support, as we had already discussed the basic algorithm. Okay, the basic life support. So these are the things: unresponsive patients, shout for help, open airway, check breathing, call the emergency line, and in the meantime, initiate the 30 chest compressions. So what is effective chest compression? It's very important. Doing CPR is fine, but a good CPR is the one which makes the real difference. So for the chest compression, so this is how you start looking. So what happens is, from the manubrium sterni to the clavicle junction over here. So sternocleidomastoid muscles, they're having an origin from here. So from here, you try to measure the distance. So what you try to do is you try to measure at the junction point of upper 2/3 and lower 1/3. That is where you're going to keep the heel of your palm. Okay, at one, and the other one is going to just lie above that. And then you start and you must interlock your fingers before initiating. And whenever you're doing it, the rate has to be at least 100 per minute, and the depth should be 4 to 5 centimeters. Around 5 centimeters, it will always better. And always allow the chest to completely recoil. Similarly, and whenever you're possible, it is always better to keep on interchanging between 2 people, okay, every 2 minutes, to trying to avoid fatigue. So that is going to be always very helpful, in fact. And so once you have placed the heel of the hand, and you put the other hand, interlock them, do the compressions, okay, and then after that, so I have already said about it, and keep on interchanging, as I said, like every at least minute or 2, in fact. After doing this, even still, after you have done the chest compressions, so after that, you try to do is 2 rescue breaths. The other thing important is, whenever you're giving those 2 rescue breaths, pinch the nose, because if you're trying to give to the mouth, the air can be coming out from the nose. So that's why you must seal your lips over the victim's mouth, and you must blow until the chest rises, okay? And it takes at least around a second, and after that, allow the chest to fall. And then you have to keep on doing at least 10 to 12 times per minute. In the breathing, there are different breathing techniques which can be applied for the patient or the person, in fact. Mouth to mouth breathing, mouth to nose breathing, similarly mouth to mouth plus nose breathing. For example, especially for small kids, it can be done. Similarly, you can also use a mouth to barrier device, others mouth to tracheostomy as well, and you may also use a self-insufflating bag. So, what is the important thing whenever you're trying to do this is the volume which is being given to the patient, it should be the normal breathing volume. So the normal breathing volume is 6 to 7 ml per kg body weight, which is nearly 500 ml, and the breathe duration in adults, which is 1 second. So, and we all are aware expiration is pretty passive, and that's why check the chest rise during the rescue breath. So this is what we are aware what is called as the self-inflating bag. So this is the capacity. The capacity is of around 1.5 liter. There's a one-way valve, and with this you can use the atmospheric air, otherwise the oxygen source as well. So what was the key thing which I had already said? It is the ratio. The ratio is 30 is to 2. And for the compressions, we are very much aware that it should be 100 per minute. Similarly, the breathe cycle should be around 10 to 12 cycles per minute. Yes, I already said this cycle. So after the breathing has been taken care, what about the defibrillation? So nowadays, AEDs are available easily, in fact, everywhere. So what happens is these are like the smart defibrillators. Our phones are becoming smart, even the defibrillators as well. So what happens is they have advanced computer technologies. They are able to interpret the heart ECG rhythm, and they can even determine whether the defibrillation is required or not. And not just that, they can even deliver. Okay, and they can even guide the operator through other actions through voice or message prompts. And there may be some legal aspects as well for that, so one should be careful for these things as well. So why AEDs are slightly more easier than the CPR. They are easily available on areas wherever there is heavy people concentration as well. And yes, AEDs can easily be used even by the common citizens. In fact, so this is the good rhythm. I would really like you all to pause and have a look, which I already explained, in fact. Okay. So after everything has been done, so what happens? The AEDs will automatically switch on himself as soon as you just need to open the lid and it will be on. So then after that, you try to take out the pads and attach it to the casualty's bare chest. And so the AED is going to analyze the rhythm, and during that, it will ask you to take off your hands as well. So whenever it is going to be ready to shock, and so when the shock is indicated, stand clear. So you should not be touching the patient's body. Okay, and yes, the rescuer is responsible for not only his or her safety, but also the people who are around that. After the shock is delivered, immediately it should be resumed 30 is to 2, 30 is to 2. It should be going on, it should be going on. Okay, and what happens is if the AED is not available within up to 5 minutes, you should carry on with the this compression to breathing, in fact. And however, if you're able to notice the person is starting to breathe normally, try to place him in a recovery position. And as I had said it, what happens is, yes, so I had already said it a lot of times, you should stop. You may consider stopping after 20 minutes. However, so there are some exceptions as well. So, for example, if there is someone with hypothermia, otherwise persistent VF is going on, then it is not like this. You should stop. You should continue, ideally. Okay, and you must be able to use AED as well. So now there's an interesting term which is called as precordial chest thump. So precordial chest thump, I'll try to explain. So what happens is you'll try to keep your knee at the level of umbilicus of the patient. And you put your fist in front of the precordium firmly, and without elevating your knee. You have to just raise your hand and, and try to kick as hard as possible. So this is what is called as precordial chest thumb. But it is indicated only in cases of witnessed cardiac arrest and only for adults and within 20 seconds. So only if the patient has arrested in front of you, only then you should do it. It should be done only by experienced rescuers. Other than that, yes, if someone is having a chest injury or for kids, you should not use it at all. So now let's try to go slightly a bit more deeper. So about the airway, some of the maneuvers which should be used is the head tilt. So head tilt, chin lift, and what is the other thing? Which is called as the triple maneuver. Triple maneuver is the one which is called as jaw thrust. So you should hold it over here carefully and then do the jaw thrust. But it must be again done by only an experienced rescuer or by a physician. I wouldn't I won't recommend a common person, non-medical professional to be doing this. Similarly, so what happens then after that? You try to, for the lower jaw to be pulled up forward, in fact. So what you're trying to do during all these maneuvers is you're trying to clear the air passage which is there. And the air passage which could be getting obstructed is due to, a lot of times what happens is due to the lung displacement. So if someone secondary to a coma or trauma or the cardiac arrest as well, the person can be having all these things. Similarly, a lot of times the tongue edema may be there due to the laryngeal spasm or so these problems can be happening. So if there may be a foreign body which leads to laryngeal, tracheal or bronchial obstruction as well. Similarly, if there is a trauma which can further lead to laryngeal damage. Otherwise, there is infection anaphylaxis which can further cause laryngeal edema. So these are some of those reasons which you all have to be careful for that. And whenever we are thinking for the airway management, so if there's an unconscious patient, try to have a look about tongue. So because a lot of times tongue is the one which will be going back and causing airway obstruction as well. So that is why you should encourage the victim to cough and give some hits to his or her back. So that is the reason cough is quite a lot effective than any other maneuvers. So something else is called as Heimlich maneuver. So Heimlich maneuver is, it comes again under airway management. A lot of times what happens is someone is eating, having dinner or some food which goes in the windpipe and cause obstruction. So that's why it is easily commonly witnessed and we must intervene immediately, in fact, and we can really help them by giving several thrusts. So there's a position one has to go from the back of the person and hold it, okay? But one should be really careful whenever trying to do it for the pregnant ladies or even children as well. So what are the signs of large airway obstruction? We will be able to notice the person is having complaints of suffocation or difficult intensive inspiration. Otherwise, there's croupy sound which is present with the inspiration. Otherwise, there is a barking cough as well. So those are the ones which makes it visible like this. And similarly, then how about those severe airway obstructions? So severe airway obstructions, we can see the patient is having difficult intensive inspiratory effort. Powerful breathing movements may be seen. In fact, the neck and the thorax soft tissue retraction will also be seen. In fact, and you won't be able to hear any breathing. And yes, patient will be having different signs like the restlessness, convulsions, coma, blue skin color, in fact. So there are various equipments which is available for that. You should use that as well. Now coming to the airway, breathing and circulation. So what about circulation? What is happening? So in the circulation, so you should be able to see for the various signs of functional circulation like the breathing, coughing, movement, skin conditions, responsiveness, pulse as well. And yes, the pulse list of the major arteries should be seen and can be better observed by the experienced rescuers. So something is called as compression only CPR. So a lot of times what happens is there is reluctance of some of the rescuers to do any mouth-to-mouth breathing. Otherwise, the person is unwilling to breathe, or you are, or what has happened, the person has had vomiting, there's bleeding or trauma. Otherwise, the rescuer is not adequately trained. So that is the time you can always do even chest compressions only as well. And it is always better. Something is better than nothing. Okay, so that is why chest compressions as well is not so bad idea, in fact. So this is again a newer recommendation. So what has happened, it should be at least done in the first 10 minutes. Yes, however, if there's only a kid, otherwise if it is happening due to choking, you should not do. Look at this lovely beautiful kid.